When you're helping someone who's living with dysphagia, it can be very, very stressful because a lot is tied up in food for us. Food can equal love for us. If I can get you to eat, this is how we connect. But if someone is not able to do that anymore, or is not very good at it anymore, it can be very scary for the caregivers and the whole family.
Eating is not just it's not a medical intervention, it's a social event, and it's part of living, it's being part of the family, it's part of communicating and being part of the community.
Patience is very important and key, but hopefully you're doing the best job that you can to help support your loved one.
Dysphagia, simply put, is difficulty swallowing. The phases of dysphagia, beginning with the first phase, the oral phase, involves first the collection of the food or the liquid in the mouth and moving it to the back of the mouth with the tongue. And then in the second phase, which is the pharyngeal phase, the food or the liquid moves from the base of the tongue into the pharynx. And that is a critical phase because that is where food or liquid can enter the windpipe or the airway if there are any problems in the pharynx, the throat area. The goal in our assessment is to obtain patient safety first, to prevent aspiration from occurring, aspiration being the entry of any food or liquid, and the patient's own secretions from entering the airway. We, as speech pathologists, help the process of diagnosis of that occurring by doing further diagnostic swallowing studies, such as the modified barium swallow study that scans the food or the liquid from the mouth down the throat and through the esophagus. Then the third phase of swallowing is the esophageal phase that extends from the base of the throat down to the top of the stomach. There you can have problems of food or liquid that get stuck and can reflux back into the throat or the pharynx, thereby causing aspiration.
Dysphagia or swallowing difficulties can be a problem with older adults, mostly for two main reasons: is malnutrition, because if you have trouble eating, you're going to eat more slowly and not get all the nutrients in that you need each day. And then also problems with food going down the wrong pipe, and food coming up can get into the lung and cause pneumonia. Aspiration pneumonia is pneumonia due to food particles or saliva going down the wrong pipe into the lungs.
Gastroesophageal reflux, or GERD, is common. Reflux patients typically have heartburn as their cardinal symptom, but other problems, including trouble with cough or vocal problems, throat clearing, particularly nighttime reflux, which people can sleep through. The management in terms of either medications, diet, or lifestyle can be different and make a big difference in terms of reducing not only symptoms, but the risk of more serious complications like aspiration pneumonia, scarring, bleeding, things like that. After a meal, making sure that the individual is upright for 30 minutes to an hour can help reduce symptoms. Avoiding certain foods, and those include spicy foods, acidic foods like tomato products, citrus products, chocolate and mints. Alcohol, tobacco are all aggravators of acid reflux. Making sure that they don't eat or drink much for several hours before bedtime. For some people, having the head and chest elevated when they sleep can reduce or improve symptoms. After the therapist figures out what the problem is, figures out different strategies,
to help them eat and swallow in the safest way possible to minimize the risks of aspiration.
There are aspiration prevention interventions, and there are feeding guidelines that can be done to increase the safety of the individual and or improve their swallowing.
With all of these different types of interventions, with change of medications as well as strategies for swallowing, working as a team together with the family, finding the foods that they really like to eat, everything together can help improve their ability to swallow and improve their quality of life.
If a person is diagnosed with dysphagia, my role is to help them try to still meet their nutritional needs with finding appropriate foods that will be safe for them to consume. Different types of consistencies the person could be placed on would be a chopped consistency, a minced consistency, or a pureed texture as possible thickening of their liquids, including nectar thick, honey thick, and pudding thick. We help to teach them what is the proper consistency and how to prepare that. Some products can be pre-bought in the puree texture. One company is called Hormel Health Labs, or you can do a search on the internet. Other companies and other products will populate, as well as pre-thickened liquids can be found on the internet. If you wanted the option of thickening other types of beverages for your loved one, you can buy just the unflavored thickener. Two common products are called Thick and Easy or Thicket. You can find those at any local pharmacy. If you find that the person is really not able to keep up with their nutritional intake, there are oral nutrition supplements available commercially. Some common products would be Ensure or Boost, and you can also find those at any local pharmacy and Costco, Sam's Club. We try to encourage families to still prepare your food as you normally would, and depending what texture the person needs to have or safety, as long as you have a blender or a food processor at home, you can still prepare your same meal and just blend it for that loved one at home and still give them the quality food and nutrition that the rest of your family is eating.
Oftentimes, as people get older, they may eat less naturally anyway because they're not as active. They're more sedentary. They're lying around more. They don't really use a lot of calories. And so they may not need to eat a whole plate of food. And if they eat only, half the plate, they may still maintain their weight, and that would be fine.
With dementia, dysphagia is a common issue that comes up because dementia is not just memory impairment, but it's a degenerative condition of the brain. So the brain is slowly dying, and your brain controls everything about your body, from your memory to things like swallowing. Once dysphagia is starting, if it's because of a kind of dementia, whether it's Parkinson's disease, Alzheimer's disease, it's going to change over time. So our approaches have to change with the person. You lose those mechanisms that help us not aspirate. For example, if you have something go down the wrong throat, or if I do, I'll I'll cough, and I can cough it out. But someone who has dysphagia from dementia doesn't have that reflex anymore. So they're coughing, but it's not effective anymore. So if you do notice that someone is holding food in their mouth and not swallowing it, you definitely want to not keep putting more food in their mouth. Take a step back and offer something to drink to see if that helps wash that down, but also watch for the swallow with the drinking too. If there's no swallowing with eating or drinking, it's time to stop because they definitely have a high risk of aspirating at that point. The caregiver is so important in this relationship, and it is a relationship between the caregiver, or the person who loves and cares for the person living with dementia, and the person who has dementia and is starting to have swallowing difficulties, because that person who's living with dementia and having these difficulties can't explain with words what's happening. Caregiving for someone who's living with dementia is not something you can do all by yourself. You need a team to work with you and to help you and support you in addition to the person who's living with dementia. It can be anyone, friends, even outside paid caregivers can be a vital part of helping you and the person you love who's living with dementia be successful and have a rich life and moments of joy throughout the journey with dementia. Sometimes the problem with eating might be dental. A person who's living with dementia might not be able to express that they have a toothache, or they might have lost so much language, or the way the pain is being processed by their brains is not like you and I would process it. They can't tell you in words. So it's up to us to check all those different aspects, what's happening with the tooth. Dementia is ever changing, so it is a progressive, degenerative neurological condition. So it will change over time. You can't go back to where you were. Even with all of our interventions, they're still going to be at risk of aspiration, and that's just part of the disease process.
At Haleho Aloha, we have about 95% of folks with dementia, and among those, a little more than half that do have some sort of dysphagia. Our staff will make sure, as much as possible, that our residents eat as much as they can, no matter how long it takes. So sometimes it'll take an hour or two, but as long as they're interacting with the resident, talking story with them, joking around with them, eventually they do eat everything on their plate. Our staff is trained to look for signs and symptoms of dysphagia. For example, if someone is coughing during a meal, we'll see if that person is able to actually cough up what they're choking, and wait a little bit before we start to feed them again. So it's really important to watch the positioning of a resident when we feed them. Our staff will make sure to appropriately position a resident so they're sitting up straight, so their food goes down properly. Same as if we were feeding someone in bed, we want to make sure that the angle is appropriate for them. We have residents that have a hard time swallowing their medications because of the dysphagia. We will crush the medications and either mix it with applesauce or ice cream or even within the food itself.
You'll want to make sure that the environment for dining is peaceful and without a lot of distractions, because you'll want their focus to be completely on the food. They still love food and love eating. They just have issues with chewing and swallowing. So what we can do is prepare delicious food that they love, whether it's food that they connect to from their culture or their childhood. We need to make sure it's delicious. So just because it's chopped or pureed doesn't mean it can't be wonderful to eat.
We do have residents, of course, of local nature who prefer local foods, and so we try to accommodate them by pureeing foods like Portuguese sausage, Chinese, Japanese, even Korean foods. Poi being that is a very hearty starch, we like to add it to our ensure to create a consistency that normal dysphagia patients can't take. So by adding the poi, we add a little bit more of nutritional value and a consistency factor.
An example of a very simple breakfast meal that can be easily chopped or pureed is scrambled eggs, toast, and a local fruit like papaya or banana. Those blend up very, very smoothly if you put them in the blender and add a little bit of chicken broth or milk or a little bit of water. If you're pureeing things that are drier, breads or anything that doesn't have a lot of natural liquid, you're going to need to add liquid in to make it smooth in the blender. With toast, I would say chicken broth or, again, milk would be a good thing to mix together. There are a lot of preparations that are naturally moist and liquidy. A good example is a local shoyu chicken, which is very, very tender and has a lot of broth that can be used for both pureeing the chicken itself, but also you can use that broth if you're pureeing the rice that you're going to serve alongside it. Or you can use it as a gravy on top of the chicken itself. So there's a lot of flexibility there. So generally, moister, softer foods are easier to puree. If they're drier, you'll need to add the moisture back in. Today, we have Japanese simmered kabocha pumpkin and also a steamed broccoli. Both of those things can be pureed with chicken broth or with the teriyaki chicken sauce that we had on the side and be smooth, delicious, and easy to swallow. There are some natural thickeners that you can add to purees that help change the consistency to make it easier to swallow. Bananas, avocados, and cooked potatoes all can be added into any puree. When you're helping someone who's living with dementia and dysphagia to eat, It takes a lot of patience and understanding what skill they have left and helping them use that to the best of their ability. They can still really enjoy the food and your company because it's all about the relationship. So you're there to help them and support them, and that's what matters.
The interactions that happen during eating are really treasured moments that people really need to hold on to and remind them that they need to do that. In fact, the longer it takes to eat, the more treasured time you have.
I need to keep myself healthy because as far as I'm concerned, my parents have done a lot for me growing up. So I want to make sure that as long as I'm healthy, I'm going to have them age in place here in their home. I work all day, but every morning it's a routine for me to come to my mother's house and make her breakfast and change her in the morning. And this is what I feed her every morning. It's oatmeal, yogurt, applesauce. My mom is in this condition because of a stroke. I never thought I could do this. I managed to be creative and able to care for her. That's why I encourage people who can stay home, children or loved ones can help, have them stay home and do what you can for them. There's all kinds of different foods that she enjoys eating. I don't even have to put it in the blender. If you smash everything up, the beef stew with lots of gravy and potatoes, you can just smash it up yourself and give it to her slowly. She has a really big appetite. For lunch, she loves to eat poi and canned sardines and local foods that she enjoys eating, or poke. She likes those kinds of food. She gets a well-balanced meal, but there's sometimes where she eats more than she should when it's all about fresh poi.
There can be a point where the individual is reaching the end of their life, and the best that you can do for them is to make life comfortable and pleasurable for them.
As dysphagia progresses and a person is unable to eat, this can be very distressing. Hospice is really helpful for supporting the family through this really difficult time and helping them focus on quality of life.
In the end of life, the relationship is the most important part, not whether food goes in or not. We are still there present for them. They are showing us that they no longer want or need that food as they reach the end of their journey, and that's something that can be very difficult, but we're called upon to respect.
Knowing how to manage dysphagia helps us improve the quality of life for our older patients.
It's so rewarding to be able to help someone who has difficulties swallowing.
The most important thing is quality of life and the relationship we have now in the present.
We welcome the input of the caregivers because they are the key to making everything work.